Everyone, and welcome to the penultimate Great Decisions for 2018. Great to see so many people here again this evening. I'm going to keep it very short and sweet because we have a fantastic presentation this evening, and you would much rather listen to our presenter than to me. But as always, I would like to start by thanking our sponsors for the event, the League of Women Voters of Manitowoc County, the Manitowoc Public Library Foundation, the Friends of Manitowoc Public Library, the Lakeshore Unitarian Universalist Fellowship, and the University of Wisconsin-Manitowoc. So a round of applause for our sponsors. If you would care to make a decision to the foundation, if you would make a great decision to make a donation, there we go, that's what I should have said in the first place, to the foundation in order to keep programming such as this going. You've heard my spiel for 7 weeks now, so if you feel that that is something you would like to do, there is more information by the back door, by the door where you come in, and on the table as well. So I won't go over that this evening anymore because you've heard it already. I also wanted to mention that if you don't have the Great Decisions booklet, that is still available. We have approximately 8 copies, and they are being offered at the fire sale price of $7.50. So, if you don't have one yet, please pick it up. And without further ado, I would like to introduce Nancy Hilmer, who will be introducing our presenter for the evening. Nancy.
Oh, I got to get behind. This is amazing. This is truly amazing. We are so fortunate to have this level of a program in this town. It is just really wonderful. I just came back from Australia, New Zealand, and Fiji. And I'm a little backwards, you know. I want to sleep all day and be up all night. But I always wanted to do that, I guess. And we had dinner tonight, and I am so impressed with what is happening in world health in those places, and how much is being done in the name of health care for whole populations. It is wonderful. So tonight, Ann Dressel is here, and she's an assistant professor in the College of Nursing at UW-Milwaukee. And it's so interesting because they have started a brand new program there with certification. She's the director of the Center of Global Health Equity and spearheaded the development of UWM's new bachelor's degree in global health. I think that sounds so interesting, as well as the Global Health Certificate. She facilitates and co-leads the college's Global Health Study Abroad program to Malawi, Kenya, Ecuador, and directs the Global Health Research Focal Area. She works with 2 research teams, one in Malawi and Kenya, and second team in Ecuador, with a focus on food security and housing among vulnerable populations. Most recently, she co-authored the American Public Health Association's policy statement on U.S. Global Food Act, which will be used to lobby U.S. Congress. Good luck. Good luck. Ann grew up in a rural farming community in southeastern Wisconsin and is a lifelong Wisconsin resident, which is really nice. Her and her husband enjoy biking, and blows me away, they biked to Connecticut. You know, I can get to the corner and back, and I think, I did a really good job. But she's biked, and then around Lake Michigan. And she said that one was tougher. But of course, you can't bike across Mackinac Bridge, so you have to call somebody, and they come pick you up in a truck and take you across. Correct? Yeah. So very, very interesting. She also has 2 children, growing, completed their education, and now working. So with no further talking by me, here is Ann.
Thanks, Nancy. Nancy, here's here.
Oh, yeah. I got one in every room, every closet.
Thank you so much for that introduction, and I'm so happy to be here tonight. I'm really excited. I really want to thank Manitowoc Public Library for organizing this series. I think it's really important to have events like this throughout Wisconsin. It's really important for all of us to become aware of not only global health issues, but global issues in general. And I want to ask about your reactions to the map on the slide.
It's upside down.
Is it upside down?
Yeah. For us.
Someone said for us, right? It's certainly upside down from what we're used to looking at, but Nancy mentioned she had just been in Australia. It's very common to buy a global map like this in Australia. So you can see Australia's up in the center on the map. Is this upside down? No. It's not, right? It's just we're used to seeing the world presented in a different way. And I use this slide just to help us reflect that, you know, we're so used to seeing things the way we were brought up to see them, and there's many ways to look at the world. So just keep that in mind as we go through our discussion tonight. So what we're going to do this evening, we're going to talk generally about what is global health. It's a very broad field. We'll be talking about some key global health indicators. We'll be talking about the global burden of disease, the United Nations MDGs and SDGs, and that stands for the Millennium Development Goals and the Sustainable Development Goals. We'll talk a little bit about why should we care about global health. And then also we'll brainstorm some ideas about what each of us can do to help improve global health. So what is global health? Well, we're going to step back and talk generally about what is health. And this is a definition that's used by the World Health Organization. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. Do we use this definition in the United States? How many of you think yes? I would totally agree with you. Most of you are saying no. We do not tend to use this definition in the United States, right? Our healthcare system here is set up, you wait until you're sick. And then you go to the doctor to get cured, put on some medications. If you're injured, you go to the hospital. There is only 3% of our healthcare system here in the United States is focused on prevention or focused on well-being. And when's the last time you went to the doctor and they asked, how are you doing socially? How's your social well-being? Right? But this definition is what gets used in much of the rest of the world. And I'm housed in the College of Nursing. If any of you are nurses or you have children going into nursing, nurses tend to fall into more this kind of definition as well. They're much more holistic. So what is global health? Well, first of all, there is no one accepted definition of global health. And I've got just a couple of examples up here. The first one, global health is an area for study, research, and practice that places a priority on improving health and achieving equity and health for all people worldwide. And I just want to point out the word about achieving equity. So that means we want everyone to be healthy. Not just people in the rich countries, not just people in the urban areas who have easy access to hospitals or clinics, but all people. We want equitable health worldwide. The second definition comes from the U.S. Institute of Medicine. Global health includes health problems, issues, and concerns that transcend national boundaries and may best be addressed by cooperative actions. Sounds like a nice bureaucratic federal definition. The third definition is the one I use and the one I like, partly because it's short and it's the easiest to understand. And it comes from an organization called One Health. The idea of healthy people living on a healthy planet. So if you think about global health, if you think about things like public health applied on a global scale, so there would be a real emphasis on prevention, a real emphasis, as Nancy mentioned, on population health. So not here, where we have a focus on individuals. One person gets sick, one person goes to the doctor to get better. But population health, how can we make whole communities healthier, whole populations healthier? And environmental health is a big piece of that. So asthma is a growing problem here in the US and around the world. What's going on in our environment that's causing that to increase? And if you could think of some examples here when we think about public health, we certainly have public health policies here in the US that have been put into place. Can you think of any examples? Vaccinations, right? Flu shots, right? For kids to go to school, they have to be vaccinated, have proof of vaccination, or get a religious exemption. Yes?
Water, lead.
Yes, so lead in the water is a big problem. We want to get that out. But what else is in our water that's a public health initiative? Fluoride. I'm trying to think of a positive thing. Fluoride. Fluoride is something that was intentionally added to many of our water supplies, right? So we'd have better dental health.
But is it more so beneficial?
Fluoride? Yes, it definitely helps with dental health. Yep.
Or is it and there are pharmaceutical companies pushing the flu shot?
We'll come back to some of these at the end too. Yep. But we've got seatbelt laws now, right? Mm-hmm. We didn't used to have those. We had data that we knew it'd be safer if we buckled up, but to save us from ourselves, because a lot of people wouldn't buckle up until a law was put in place, we've got seatbelt laws. We have no smoking laws now. That's another public health policy that was put in place to protect health for all of us. Birth control. That's it. Yep, and we're going to be saying more about that too in a minute. Yep. Pollution, what can we do to, right. So I know there's discussions going on now in Milwaukee with some of the coal plants down there about what can we, because they contribute a lot of pollution to the air and contribute to poor air quality. So what policies can be put in place to help improve air quality for all of us? And air quality is a big one. We're going to talk about more in a little bit. It's very important. We'll be talking, that's on our next slide. It's like you're a plant back there. So as we talk about global health, let's think about where we are right now in the world. There's about 7.6 billion people in the world right now. It's a really big number, kind of hard to get our heads around. But the population growth has been relatively recent. In 1960, there were 3 billion people in the world. So for many of us within our lifetime, the world population has more than doubled. And it's anticipated that by the middle of the century, by 2050, we're going to get to about 10 billion people. So another almost 2.5 billion people in the world. And you can see the most populous countries. China at 1.4 billion, India at 1.3. The US is number 3, 326 million. Indonesia is next, and then Brazil. And if you look at the populations of the US and India, India has about half of the landmass as a continental United States, but more than 3 times as many people. So think about that too, as we're going to be talking about infectious and communicable diseases in a little bit, when you have so many people in such a small space. And you mentioned China before. So the picture in the top left, that's a picture of my daughter. And this is, you can probably see, it's the Great Wall of China. This is quite a ways outside of Beijing. And that's the way the sky looks. So this is in the rural area outside of the city. And I don't know if you can see, the air looks kind of brown, kind of gray. The smog is so bad there, especially in Beijing and Shanghai, that it's considered a hardship post for US government workers going there. They're advised to leave their children back in the States because the air quality, and you had mentioned pollution earlier, the air quality is so bad. But China has a growing middle class. People want to drive cars. People need electricity. They burn a lot of coal. So, you know, as we think about the population growing, and that pollution doesn't stay right there, right? That spreads many places. The bottom picture is from Japan, the bottom right. And I don't know if you can see the gentlemen in their uniforms. Can you see what they're doing on the train?
Yeah. It looks like they're pushing people.
They're pushing people.
Oh my God.
So the doors will close. It's better than my husband's stories when he used to live in Ukraine. He said the trams would be so crowded and people would be hanging onto the door, and the tram drivers learned to lurch the tram so people would fall off and they could keep going. But these numbers are big, right? And they're going to get bigger. So think about that in terms of global health and how that's going to impact all of us. We all need water. We all need food. We want jobs. We want health care. So just keep this in mind as we continue with our discussion. So we'll talk about a few global health indicators. And basically what this is data, and this is statistics. This is the fun part. Right? Usually most people think it's not. But we're just going to talk about 4 quick ones, just what they are. One is infant mortality rates. So this is the number of babies who die before they turn 1 year old per 1,000 live births in a given year. We're going to be looking at this a little more closely because infant mortality rates, you'll hear it called IMR, infant mortality rate, they often get used as a pseudo measure for a country's overall health. So if you don't have much time, you want to compare a couple of countries, you might look at their IMRs, their infant mortality rates, and you can get a quick overview of, oh, this country's probably generally or healthier than this one because they've got a better IMR. Life expectancy at birth is just what it sounds like. If a baby's born today, here in Manitowoc, how long can it expect to live? Maternal mortality ratio, this is the number of women who die from complications of pregnancy or childbirth, per 100,000 live births in a given year. And we're going to talk a little more about this one as well. And then child mortality rate. So this is kids who die before they turn 5 years old. So the infant mortality rate, that's babies who die before they turn 1. Child mortality rate, kids who die before they turn 5 per 1,000 live births in a given year. But we need this information because how do we know we're making any progress? We collect some of this data, we put some programs in place, and so the way to tell if things are getting better or worse, then we collect the data again and see if we're having an impact. It can allow us too to compare different countries or different groups within countries. And you'll see my quote up here from Mark Twain. There are 3 kinds of lies: lies, damn lies, and statistics. So keep in mind when you're looking at data and numbers, first of all, it can be hard to get good numbers from a lot of places in the world. There's a lot of places just don't have the infrastructure set up to be collecting good data, and it can be difficult to get. And secondly, when you're looking at data, look at where it came from, right? Look at the source. Is it reliable? The World Health Organization, I would say, is excellent, and they have a lot of data if you have to be looking anything up. So let's take a look at infant mortality rates. And again, as I mentioned, this gets used as a pseudo measure of a country's overall health. And this is looking for a 50-year time span between 1960 and 2010 at 5 high-income countries. We've got France, Ireland, Sweden, Switzerland, the UK, and the United States. So between 1960, which is on the left side of the chart, and 2010, the lines are going down, correct? So does that mean things are getting better or worse? Better, right? That means fewer babies are dying. What I would point out, though, is the red boxes that are on the top, that's the United States, which means those other countries on the chart are healthier than we are. They have fewer babies dying than we do here in the US. We're going to talk about that too. Here's the countries with the 10 worst or the 10 highest infant mortality rates. We've got Afghanistan with 112.8. But there's many more than 112 babies dying there every year. That's 112 babies per 1,000 live births. That's a lot of babies dying. You can see the other countries here: Mali, Somalia, Central African Republic, Guinea-Bissau, Chad, Niger, Angola, Burkina Faso, and Nigeria. With the exception of Afghanistan, where are these countries?
Africa.
Yep. Sub-Saharan Africa, right? So you can think of some reasons why they might have high infant mortality rates. Right, there's high levels of poverty. There's a lot. Yes. Who said plumbing? Yeah, lack of sanitation is a huge one. Usually I throw questions out to students, but this is great. Yes, so what? So lack of sanitation, what else?
Lack of water.
Lack of water, lack of clean drinking water. We don't think about that too much right here on the Great Lakes, right? It's a big problem many places in the world. Lack of access to healthcare services. Not enough doctors, not enough nurses. There's something called brain drain, where nurses and doctors who are trained in some of these low-income countries end up moving here to the US or the UK or Australia or other high-income places because they can make more money.
What about the low value of women?
That's a huge one.
Yeah.
And we're going to be talking about that a little bit too. Gender norms, or the low status of women, contributes to problems too.
High population.
Africa actually has about 16% of the global population.
Really?
But that's a good comment to bring up about high population, because it is something that certainly our perception here in the US is, oh, there's a lot of poor people there. And we have this idea there's a lot. There are a lot of poor people there. Corrupt governments is another issue.
Yeah, exactly. Mismanagement of.
So, yeah, so funds might be sent over there. Are they getting where they need to go? War. So not just within countries, but what are we doing right now in Afghanistan? Is that impacting health? Are people being injured or killed? Are people being displaced? On the other hand, the US government is also doing a lot of rebuilding efforts there as well, and trying to do education as far as to improve the status of women. So here's the countries with the 10 best, or the 10 lowest infant mortality rates. Monaco, Japan, Iceland, Singapore, Norway, Finland, Bermuda, Sweden, Hong Kong, South Korea. What I would point out is US, we are number 56. 55 countries have lower infant mortality rates than we do. But we are number...
Several countries, right? Several countries got lower infant mortality than the United States.
Yes, 55 do. 55 have lower infant mortality rates. But we are number one in healthcare spending. So we'll be talking about that too. Why are we spending so much more, but our health outcomes aren't as good as they could be? The US is the only, so one thing these countries that have in common with the low IMRs, they tend to be wealthy. And we talked about the African countries tend to be poor. They all have universal or national health care. The US is the only industrialized country with a national healthcare system or a universal healthcare system. So this slide just shows a disparity. Look at the difference between Monaco and Afghanistan, the countries with the worst and best infant mortality rates. It's 100 times higher in Afghanistan. And it's not just globally. So I work in Milwaukee, and the white infant mortality rate there is about 5 babies that die per 1,000 every year. For black babies, it's over 13. In fact, the disparity between Milwaukee's infant mortality rates for black and white infants is one of the worst in the country, in Milwaukee. We have a lot of work to do there. And here in Manitowoc. So I was surprised to see, so the most recent data that's available through the Wisconsin Department of Health Services, they actually don't have an infant mortality rate for 2016 because there were fewer than 1,000 live births here in Manitowoc County in that year. However, they do have data on low birth weight for babies, and that is a risk factor for infant mortality. And you can see here for the white babies, 9% of the babies that were born were considered low birth weight, so that means they were less than 5 pounds 8 ounces. 20% of the black babies that were born. So you can see there's disparities here as well. We'll look at another one of these health indicators, life expectancy at birth. So I always say this cartoon could be my mom. One, it sort of looks like her, but two, that's also the way she drives. So here's the countries with the 10 highest life expectancies. Japan, Switzerland, Singapore, Australia. The USA, we're at number 31. So there's 30 other countries in the world. If you were born there, you could expect to live longer than if you're born here in the US. And what's more disturbing is our life expectancy here in the US has actually gone down in the last 2 years. It's gotten worse, it's gotten lower. Part of that, though, they attribute to the opioid crisis. And with younger people dying, it's sort of pulling down that average. And here's the countries with the 10 worst or the 10 lowest life expectancies. And again, I can hear someone mentioning sub-Saharan Africa again. But think about that. If you're born in Japan, you can expect to live almost twice as long as if you're born in Angola or Sierra Leone. And this is going to become a more pressing question as the years go on. Is this fair? Do we have a responsibility to do something about that? Here's looking at life expectancy again in the US, the disparities here. 76.7 years for a white male, 72.5 years for a black male. And again, here in Manitowoc County. So I will say Wisconsin in general, our life expectancy is higher than the national average. And here in Manitowoc County, you're even higher. But you can see men in the 54220 zip code can expect to live 77.4 years and women 81.7 years. Milwaukee, where I work, we've got a number of zip codes. I purposely picked the worst one just to show this disparity. But the 53206 zip code, so it's one of the poorest zip codes in the city, but you can see the average life expectancy is 71.3 years. 10 years worse than a woman born here in Manitowoc. So why should zip codes tell us about how long we can live? And there's recent research that has come out that says that's actually the best predictor here in the US of how long you're going to live is what zip code you are born in. So why should that matter? Why does where we live have such an impact on how long we'll live? Or globally, how does where we're born and where we grow up affect our health? So there's many things that determine our health. Some are individual traits, so our genes that we're born with. Our sex, you had mentioned gender issues before, so whether we're male or female. There's issues both biologically, but also cultural norms surrounding that. How old we are. Young babies, very old people are more vulnerable. But that's just a tiny bit of what determines our health. There's many additional factors that impact it. So one is the physical environment. We've talked a little bit about that. Do you have access to clean water and sanitation? Air pollution was mentioned. In addition to outdoor air pollution in much of sub-Saharan Africa, and we were looking at those high infant mortality rates, they have a very high incidence of respiratory illness among women there because they're cooking inside the homes, often in little huts over open fires. And when we've taken students to study abroad in Malawi or Kenya, especially in Kenya, we can go down and visit the Maasai who live in the southern part of the countries and still live in a very traditional manner. And the women are in there cooking in their huts. They got the baby strapped to their backs, and we can hardly step foot in there. The smoke is so thick, but they're used to it. But there's been a big push globally to develop clean cook stoves for women to use, something that's culturally relevant that people will actually use, but we're not quite there yet. But so the physical environment plays a big impact on your health behaviors. Right? Do you use your seatbelt? Do you eat healthy food? Do you exercise? For my students in college, I always say, do you use condoms? Access to health services, another thing that'll impact your health. Do you have access? Not only geographically, but financially. Unpaid healthcare bills are the #1 cause of bankruptcy here in the United States. Something that other industrialized countries can't even imagine. Like, what? You mean people are going bankrupt because they can't pay their healthcare bills? And related to healthcare access, we've got a shortage of doctors and nurses here in the US. But the World Health Organization states globally we're short about 7 million healthcare workers right now. And by 2035, we're going to be short about 12.9 million healthcare workers globally. So it's a problem for us. It's a problem globally. And the other piece we play in this is, as I mentioned before, we're often actively recruiting people from other countries to come here and work because we need them. A quarter of all doctors, medical residents here in the US are foreign born. But again, so it's nice for us. And a lot of them do send money back home, but that money goes to their families. It doesn't go to the government, who might take some taxes off, and then they could, provide services for everyone. So again, think about what is our role in some of these issues globally. But the biggest thing that determines our health, and we're thinking about the zip code before, is something called the social determinants of health. So where do you live? How much education do you have? What kind of housing do you have? What kind of employment do you have? Gender norms were mentioned before, and we'll be coming back to that. Recent research says that 80 to 90% of our health is determined by these social determinants of health. 80 to 90%. So as we think about health determinants, here's a picture from Ethiopia. What's going on in this picture that might impact health? So someone said the cow is standing in the water. What else? So cows are in the water. Well, what else is going on? I heard someone saying they're drinking it. So there's cows standing in the water. Yes, they're there to get the water to bring back home for drinking. Who's getting the water? Women. In places around the world where people have to go and get water, in most places it's women's work. And women on average spend 4 hours every day getting water. 4 hours. And I'm sure many of you are from Wisconsin, so I'm assuming a number of you have been camping. What's it like hauling water? It's heavy, right? It's heavy, it's hard work. But think too about these women. If they're spending 4 hours hauling water, or girls, what are they not doing? They're not in school. And in this picture, the women have shoes on. Many places, people don't have shoes. It puts them at risk too. There's worms are a big problem in Africa. Intestinal worms and parasites. There's actually, former President Jimmy Carter's done a lot in deworming campaigns around the world. But there's certain kinds of worms you can get, they embed through the soles of your feet. So again, there's many risks women face in addition to just the drudgery and the time it takes. There's other additional health risks. Would any of you want to drink this water? No, it's pretty dirty, right? So, as many of you know, dirty water can carry diseases, and it's one way people can get sick from waterborne diseases. And this chart is looking at global infectious disease deaths. The print's tiny. The only thing I want to point out is the bar way on the right, that's all infectious disease, people who died from it. But the bar way on the left, again, the world region that has the most people dying from infectious disease, sub-Saharan Africa. So just like the health indicators we looked at before, sub-Saharan Africa had the worst infant mortality rates, lowest life expectancy, most people dying from infectious diseases. About 44% of all deaths in low and middle income countries are from infectious diseases. Is that something we worry about much here in the US? Are you worried your neighbor's going to be dying from malaria? Right? Or TB? It's not something we worry about too much here. Here in the US and other high-income countries, we have problems with non-infectious or non-communicable diseases, right? Our chronic diseases like diabetes, high blood pressure, high cholesterol. And there's something now called the 90-10 gap. So that means 90% of the world's research and development dollars go into pharmaceuticals that serve 10% of the world's population. So because the money, pharmaceuticals will be developed for a company to make money, right? And you can make a lot more money selling to a high-income country with people who are on medications for the rest of their lives. You're on your high blood pressure med. We're on our high cholesterol meds. We're taking our insulin for the rest of our lives. So there's a lot more money to be made on maintenance drugs than there is for something that might cure an infectious disease. So one, infectious diseases, it's a problem in low-income countries, so they don't have money to pay for it. And two, once you've cured someone, they don't need to take that medication anymore, right? So the incentive isn't there. And we can talk more in the Q&A. People have ideas about how to restructure pharmaceutical development to address some of these issues, but we'll come to that in the Q&A. So looking at non-communicable diseases or non-infectious diseases, this chart has it split up. The top circles are low and middle income countries. The bottom circles are high income countries. Basically what I wanted to show you with this is the low and middle income countries that have such a high rate of infectious disease, they're also experiencing, and by 2030 are anticipated to be experiencing a greater number of non-communicable or non-infectious diseases as well. But just think of the stress on the healthcare systems. I mean, they can't deal with the infectious diseases and now having to deal with these chronic diseases, how that's going to impact these countries. And how well do we deal with it here in the US? How well do we do at preventing people from developing high blood pressure or high cholesterol or diabetes? There's no incentives, right? The way our system is set up. We're really good at managing it. Once you're sick, we're really good at managing it and making sure your medication's right. But think how much more cost effective it would be if we could put some money into preventing people from developing these in the first place. I have a question to myself here about why is it so hard for us to fund prevention here in the US? Any ideas?
There's no money in it.
There's no money in it.
You can't measure it.
It's hard to measure, right? The payoff can be a long ways down the road. So how do you measure that? So that's difficult. And the other thing is people still might get sick, right? You live your life doing everything right, you still might get cancer, die from a heart attack, something like that. And there's also pieces with the way our insurance is structured here. With people changing insurance companies all the time from year to year. I work for the state of Wisconsin, so almost every year our insurance is changing. There's no incentive for the insurance companies to prevent anything either, because the people aren't going to be with them long term. So again, think about what can we do? And we're exporting our unhealthy lifestyle around the world. Our processed foods, everybody wants their own car. So I've got 10, they're factoids. These are from the World Health Organization and looking globally at the burden of disease. And we talked about the infant mortality rates globally and in Milwaukee and here in Manitowoc. This slide is about child mortality rates. So again, these are kids who die before they turn 5 years old. And each year around 5.9 million children under the age of 5 die. So again, these big numbers, it's hard to get our heads around them. 5.9 million children, that's like the entire population of Madison, Wisconsin, dying twice every month would get us to almost this number. And one of the #1 killers of kids under 5 is diarrhea. So you think back to that slide we saw with the dirty water. Diarrhea and pneumonia are the biggest killers of kids under 5 around the world. Number 2, cardiovascular diseases are the leading causes of death in the world. So heart attacks, strokes, that sort of thing. It's a big problem here, a big problem in low-income countries. 80% of those premature deaths, they can be prevented through a healthy diet, regular physical activity, and making sure people don't smoke. So again, what can we do to encourage that on the front end? But we know it's hard, right? It's hard to change our individual behavior. But think about some of the context, too, that we live in. Like when your children are younger, with your grandkids, when you go in the grocery store, where do they have all those sugar-sweetened cereals?
The lower shelf.
Right? Yeah, the lower shelf, right at eye level for the kids to see. Think about the portion sizes in our restaurants.
And if they're not large enough, well, that's not a good
Yes. But many of you have traveled, right? You've seen portion sizes other places. They're regular portion sizes. Here, we're used to enormous amounts. But again, we're exporting our diet, our lifestyle, our obesity rates around the world. HIV/AIDS is a leading cause of adult death in Africa. So it's not on our radar screen as much in the US. It's become kind of a manageable disease. But Darlene, you had mentioned Africa earlier on population. So sub-Saharan Africa has about 16% of the world's population. They have 70% of the world's HIV/AIDS cases. Talk about a burden, right? A disease burden, trying to deal with this disease. The prevalence rate in some parts of southern Africa is 20%. 1 in 5 people. And it was mentioned, I work with a research team in Malawi, and we take students there as well. In Malawi, girls are much more likely to be infected than boys. And girls and women are also the primary providers of food for their families. Which usually means growing the food themselves, or they're doing some sort of piecework to get money to buy food. So when that mom gets sick or dies, the whole family suffers. The whole family isn't eating. So it becomes a much bigger issue. Number 4, population aging is contributing to the rise in cancer and heart disease. So not just here in the US, but globally, people are living longer, which is a good thing. But the longer we live, the more time we have to, get cancer and other diseases. But elderly care, how well do we deal with it here in the US? Some people have good experiences, some people not. But this, globally as well, people are getting older. And here in the US, it's our white population that's especially getting older and shrinking. Lung cancer is the most common cause of death from cancer in the world. Wow. Tobacco use is the single largest preventable cause of cancer in the world, and smoking is responsible for more than 80% of all lung cancers. So again, think about the healthcare costs for treating this for something that is almost totally preventable. And tobacco companies know if they can hook kids before they're 20, most likely they'll have them hooked for life. So here there's a lot of policy that have been put in place over recent decades, so you're not marketing anymore to kids. But in other parts of the world, that's not the case. Because if we can't get people smoking here now, if our laws are too restrictive, we got to get them smoking somewhere else so people are making money. And vaping is a new thing now here. How's that impacting us? They're just starting to get some research on that. Number 6, complications of pregnancy account for almost 15% of deaths in women of reproductive age worldwide. 15%, we think, that doesn't sound like that much. But it'd be kind of like 3 people from each of these rows dying from complications of pregnancy or childbirth. And again, it comes back to this issue of gender norms and the low status of women. And a couple of stories from Malawi when we've had students there. There was one woman who had given birth in a rural community. No, I take that back. I've got 2 different stories. I'm mixing them up. One woman who was in labor and she needed a C-section. But the rural community that she was in did not have the equipment to be able to do that. So she needed to get to a bigger town with a higher level hospital to do the C-section, which exists. They have good health care there if you can get to where you need to go. But the ambulance that was in her village had no gas. And she ended up dying. And relatedly to childbirth, one of the last groups of students we had there, again, we were in a rural community and in a hospital ward for premature babies. And the mom had died in childbirth, and so they had the baby in an incubator. And again, we think about our role or what we're doing. Someone here from the US had very generously donated this incubator because they know babies need it over there. They're hard to come by. There's no electricity. And the ward was so short-staffed, they told the students the baby probably wouldn't make it till morning. Yeah, the students were really shook up. Number 7, mental disorders such as depression are among the 20 leading causes of disability worldwide. So again, we know there's not enough resources here in the US, and again, think about what it's like in a low-income country. And another example from Malawi, they've got about 18 million people, the population, They have one psychiatrist for the whole country.
Oh my God.
One psychiatric hospital. So when we visit the hospital with the students, not surprisingly, people are just sedated because they don't have staff to take care of them. But one thing we did, we brought over one of their nurses from the University of Malawi, and we worked with her to develop a master's level curriculum on community and mental health. And that was then brought back and implemented in the College of Nursing there, in the hopes that now we can get nurses out into rural communities that could have some skills dealing with mental health issues. Number 8, hearing loss, vision problems, and mental disorders are the most common causes of disability. I think many of us take for granted if we need a hearing aid, if we need glasses, we can get what we need. I can see a number of you wear glasses. How many of you could function without your glasses? A couple of you raised your hand. So I wear contacts. I don't think I could even get dressed in the morning if I didn't have my contacts in. This picture is a picture of the woman's name Rose. She's in the top left of the picture. This is her family. They're in Moshi, Tanzania. It's a little town in the northern part of the country. She worked as a typist. And as she got older, she needed reading glasses. Not only did they not have money for reading glasses, there was nowhere to buy them, and so she had to stop work, which of course had economic consequences for her whole family. But again, to think about, the things we take for granted can make a life or death difference to people in other parts of the world. Road traffic injuries are projected to rise from the 9th leading cause of death globally to the 5th in 2030. And there's about 3,500 people dying every day from road traffic accidents. How many of you have experienced driving in especially a low-income country? Or being in a car? Was it exciting? Or can you understand why it's projected that road traffic accidents are going to go up? And again, as the population keeps growing, there's more cars on the road. And number 10, so we started this sequence looking at child mortality rates. Undernutrition is the underlying cause of death for at least 30% of all children under age 5. So once kids are sick, or once they don't have enough to eat, once they're malnourished, it makes them much more susceptible to getting sick. And it's harder for them to get better. And we grow more than enough food in the world to feed everyone. It's just not distributed equitably. And the U.S. has historically been the biggest exporter of corn around the world. But where does most of our corn crop go now?
China.
Somebody said ethanol. So again, think about our policies that are put in place here. We often don't realize what are going to be the unintended consequences. So there's less food going for food for people or food for animals that would feed people. And because there's less, the prices are higher too. So how do we deal with these? How do we tackle global health problems? Well, in the 1990s, the United Nations and many other organizations worked together to come up with something called the UN Millennium Development Goals. And these were put in place at the turn of the millennium, so in the year 2000. And by the 2015, the hope was countries would meet these goals. And each of these goals had specific targets that went with it. And I always ask my students, which of these goals relate to health? All of them, thank you, that's the right answer. All of them relate to health. So these ended in 2015, and so now countries are assessing how well did they do. So talking about those health indicators from earlier. How well did we do toward meeting these goals? Like I said, I work with a research team in Ecuador. Ecuador did very well. They met all of the goals except for number 1. And now they're spending time analyzing. Okay, we put these programs in place, these food programs and stuff. What went wrong? Why didn't it work? Why didn't we meet the goal? And I would just mention Rwanda in Central Africa has made a lot of progress as well. So the Millennium Development Goals ended in 2015, and then the Sustainable Development Goals were rolled out by the United Nations. And so these are 17 goals that are in place, and they've got targets to be met by 2030. So we won't look at all of these. I would just mention number 1 is no poverty, number 2 is zero hunger, number 3 is good health and well-being, And these also have specific targets with each goal. And we're going to take a quick look at number 3, the good health and well-being, which is specifically ensure healthy lives and promote well-being for all ages. And one of the targets for this goal is achieve universal health coverage, including financial risk protection, and access to quality, essential healthcare services, and access to safe, effective, affordable medications and vaccinations. Do we meet this target in the U.S.? No, right? And related to that, the World Health Organization, the Constitution, states the highest attainable standard of health is a fundamental right of every human being. The United Nations Declaration of Human Rights states health is a human right, and relatedly, access to health care. So again, think about how we view that here in the U.S. Do we have a social justice approach toward health and health care? Or do we use a market justice approach?
It's market.
Is that ethical?
No.
So why should we care about global health? So the first thing I would say is there's a lot we can learn from other countries, especially in terms of healthcare systems. There's a lot of countries with excellent systems that spend a lot less money than we do. But some other examples, I have Australia mentioned here. So in 1996, Australia had a mass shooting. After the mass shooting took place, they put laws in place to make sure people got background checks. They did gun buybacks. So if you had guns, you could bring them in and get money for them. People can still get a gun. People can still go hunt. There's just many more regulations now in place. And they have not had a mass shooting since then. Why aren't we learning from what's working in other places? I've got Mexico on here. So Mexico has had, we talk about us exporting our lifestyle and obesity. Their population too is becoming very obese. Diabetes is a big problem there. So about 3 years ago, they implemented taxes on soda and junk food. They have since seen about a 10% decrease in consumption of soda and junk food. They've seen a decreased incidence in diabetes and project that they've already saved about $1 billion in costs related to diabetes. So you might remember a few years ago, New York wanted to ban like the big gulp sodas. Yeah. So again, think about, so we've got data now. We can see some of these things are working in other places. What can we learn from them? I've got the Netherlands up here. So in the Netherlands, 50% of all trips are made by bicycle, by walking, or by mass transit. 50%. So they've got good infrastructure there. If you're riding a bike, all the traffic lights are timed for being on a bicycle for someone going about 12 miles an hour. So you're always going to have a green light. They've got bike lanes. They've got very good infrastructure for cycling. They've got education in place to support people on bikes. So they teach people when you're learning to drive, always if you're driving, open the door with your right arm. How come? Yes. So I'm not going to open that door up into the path of a cyclist. Just little things we can tweak that would really help. And then too, for enforcement, if there's a bike-car accident, an accident with a bicyclist in a car, it's always the car's fault. It's always the car's fault. So again, think how that might change our driving if we had something like that here. Portugal is dealing with an opioid epidemic too. What they did in Portugal is they thought, okay, we're not going to treat this as a criminal activity. We're going to treat it as a public health issue. So they offer many treatment facilities, clean needle exchanges, and other things like that. They haven't wiped out opioid deaths completely, but they've had a drastic decline. Could we learn something from what they're doing? Another reason why we should care about global health, And these first two, I think, are pretty selfish. What can we learn? But diseases travel, right? And people travel. We've had issues with Ebola in recent years, Zika, avian flu. Stuff that's happening in other parts of the world could be here within 24 hours. So we better care and know what's going on. Climate change is another issue. So with climate change, we can see a change in disease vectors. That means where diseases are happening. So here in Wisconsin, we're seeing the impact of that. We've had relatively mild winters. We've had more Lyme disease. We've got West Nile virus here now. In the US, we used to have malarial mosquitoes. With climate change, will we see that again in the US? Also with climate change, there's more severe weather events. So you have not only the immediate injury and deaths from the weather, but crops are destroyed. Homes are destroyed. People get displaced. We're seeing now climate refugees. People are having to move because of the impact of climate change. And Nancy, you mentioned you were in Fiji. Kiribati, another little island in the Pacific, is looking to buy land in Fiji so they can move their whole population because of rising sea levels. And political instability. So the uprisings that started in the Middle East back in 2008 started after several years of Tunisia and Syria. Failed crops and rising food prices, people were protesting. So again, think we're impacted by that. We're involved now in Syria. Air quality was mentioned earlier. We've got more people, more pollution, poor air quality, asthma prevalence is rising around the world. More cars, bigger cars. Do we have a responsibility to do something? What's the ethical issue with all this? What's our role? How does our lifestyle impact global health? So the US and China were the biggest emitters of CO2, which was one of the biggest contributors to climate change. Our use of resources here in the US, our uses of water, consumer goods, is far more than any other country in the world. In fact, if everyone on the planet lived like we do, we would need almost 4 planets to support all of us, all the resources we use. Is that fair? We're going to just be using this because we're happy, but how does it affect everyone else? We talked about the corn issue. You're using corn for ethanol rather than to feed people. The global arms trade. The US is the #1 exporter of arms around the world, and we often provide arms to both sides of a conflict. So again, think about not just, again, the immediate injury or death from something like that, but when a country is using its money to buy arms, it's not using that money to build schools, to provide health care. Again, what is our role in all of this? So what can we do? A few quick ideas. So one, stay informed about what's going on in the world. Read a newspaper, watch the evening news, come to events like this. Learn some geography. Oh, I'm shocked at how little the college students know. Right?
Yes.
Know where some things are, and especially, so I teach a lot of nursing students. Like the recent Ebola outbreak in West Africa, I said, okay, you've got a patient coming in who's come from Guinea-Bissau. Should you be concerned? And of course, there might be 1 or 2 who might know. Someone usually saves me. Guinea-Bissau did not have any Ebola cases, but the 2 neighboring countries did. So I would certainly be concerned if I had a patient coming from Guinea-Bissau, knowing that they were right there next to the Ebola outbreak. But also it's a sign of respect, right? If you have people coming in from other places rather than, yeah, I never heard of it. Look it up, especially now with the internet, it's so easy. Okay. Find out where they're from, ask them some questions. Number 3, educate yourself and others. So learn about what's going on and then share that. There's some excellent books suggested in the Great Decisions booklet that Mike was talking about. One in there I would highly recommend called Mountains Beyond Mountains. It's about Paul Farmer's work and Jim Kim, who's now head of the World Bank. It's a very good read I'm sure they've got them available here at the library you can check out. Number 4, study or volunteer abroad. You're never too old to do this. And our study abroad programs at UWM, anybody can come. You can come and just do the study abroad with us. We would love to have you. Advocate. So get informed about the issues and then advocate for more equitable policies. Then vote. I was so happy to have dinner with women from the League of Women Voters. Who we elect into office has such an impact on global health. We'll leave it at that. Okay. And then lead by example, right? Most of the behaviors that will improve our health will also improve the environment. So take the stairs, walk or use a bike if you can, use less water, don't waste food. Many of us grew up with these things. A big one, eat less meat. To raise meat uses far more resources than to raise chickens or fish or something like that. And finally, I would add, treat others with kindness and respect, especially people different from us, and model that behavior for your kids. That will help them be more empathetic too to people different from them and people in other places. So we're almost done here. I just want to say a little bit about some global health opportunities at UW-Milwaukee. You might have the opportunity to come down. A lot of our classes are available online. You might have kids or grandkids interested. You could share this with them. But we have a global health certificate. You can do it while you're in school, or you can be working and come back and just do the certificate. We have a Spanish for Health professional certificate. As Nancy mentioned, we have a brand new global health baccalaureate degree, the first and only one of its kind in the state. And we've been recognized from the U.S. Department of Education, their Title VI program for our global studies programs, and global health is the newest track of that. You could try just a global health class. Try one of our study abroad programs. Learn a foreign language, and I've got our website up here for more information. And I would also mention, check out UW-Manitowoc. They've got courses too, like human impact on the environment. I was looking some of these up. They have a nutrition class, which underlies a lot of global health work. They have a cultural geography class. So there's a lot right here. And I would just say thank you and open it up for questions. So thank you very much.
Any questions? Wow, there we go.
Thanks.
Living in Wisconsin as we do, wow. It works all of a sudden. I was surprised that nothing came up about alcohol, because alcohol is really rampant in the state of Wisconsin.
I actually, I have that on my road traffic injury slide, but I felt like I was running out of time. So that's a good point, because Wisconsin, for years and years, we've been the #1 binge drinking state in the U.S. We have recently been beaten by North Dakota. Yes, for binge drinking. But again, so I often bring that up in terms of the accidents and the road injuries and deaths. But what kind of policies do we have in place to deal with that? Here in Wisconsin, we're actually very lax on drunk driving laws compared to other states. So that's one piece of it, is I think there's a lot more we could be doing to address drunk driving. And there actually was a pilot program put in place in northern Wisconsin, it's probably 10 years ago now, where there was a focus group that they were having, young people were dying from drunk driving. And so they sent some researchers up there to find out why were people dying from driving drunk. And they found out that it was mostly young men in their 20s. And they were asking them, so why are you driving drunk? And they said, well, they're in a rural area, so there aren't taxis. We want to get from bar to bar. And so they said, what would it take for you to quit driving drunk? And they got grant money, actually, and they implemented a service. I can't remember the name of it. But a car would come to these men's houses, most of them farms, pick them up, take them from bar to bar, and then take them home at the end of the night.
I was thinking thinking more about the organic impact
Right.
and the brain impact
Okay.
from a lifetime of drinking.
Okay. I'm just going to finish up about my drunk driving, guys. But I will. So they did find it was almost a 20% decrease in drunk driving incidences once they put the program in place. And they've been trying to continue it with grant funds and expand it to other parts of the state. But you can imagine what it would be like trying to get taxes to fund that. Right?
There is a system like that in the bars.
Yeah.
Manitowoc, they have that kind of.
Yep, and I think more communities, that have a big enough population, communities that have a big enough population certainly have options available for people to do something other than driving, but in other parts of northern Wisconsin, there isn't much there. But as far as the alcoholism, as far as how bad it is for you, I'm not quite.
What was the question? The question was, I was thinking about the organic impact and the impact on your brain from a lifetime of drinking. That would seem to impact on longevity.
Birth defects too.
Yeah, birth defects, that's true. Offhand, I don't know the data for that, like on average how many years of your life it takes off. A lot of it depends if you're male or female, how much you're drinking, how long you've been drinking. I will say we have much less of a problem here than compared to Russia. The amount of alcohol they consume, I can't remember the number off the top of my head, it's astronomical per person. But it definitely, contributes to poor quality of life and reduced quality of life too.
Let her finish up before you ask the next question.
Somebody else I think had their hand up.
Oh.
Okay.
What is the United States commitment to global health in terms of money and support, through the World Health Organization and so on? And what would you sort of advocate?
Well, so that's a very good and kind of loaded question. So the U.S. does provide more money for global health than any other country in the world. But if you look at it as a percentage of our GDP, we're toward the bottom of industrialized country. So as far as the amount of money, yes, we provide a lot. But as far as a percent of our GDP, not so much. The other thing is we are way behind on paying our dues to the United Nations. And the World Health Organization is under the UN. We recently cut our funding to UNICEF because UNICEF, this was a couple years ago, UNICEF voted to recognize Palestine as a state. So in retaliation, the US said, fine, then we're not going to pay our dues. So I don't know if you've heard of John Oliver or John Stewart, some of the community. There was a very funny bit where they actually sent John Oliver to Ghana to a school that had been funded by UNICEF, and they show him explaining to the kids, well, we're going to take all your desks away now, and then he's explaining the Middle East situation between Palestine and Israel, and we're an ally with Israel, and now you can't go to school anymore. But I mean, it gets kind of crazy, the politics that go into some of this instead of looking at the bigger pictures. So we do contribute a lot of funds. We could be doing a lot more. Yes?
What about joint research, solving some of these health issues? Cures for all these diseases that are happening, instead of having each little lab getting money to do a little bit, instead of getting everybody trying to solve these things, the brains of the world.
Yes. So I don't know if you could hear her in the back. She said, what about doing joint research instead of everyone doing their own little thing? That is a huge problem in global health. A huge problem. There are so many silos. Someone's got funding to do their little project here, and then someone's doing something here, and someone's doing something here. In the Millennium Development Goals, number 8, one of the goals was develop a global partnership. So again, how can we get people working together smarter and tracking these things? But, it's challenging not just in global health, we see it here too, that if someone has money, they usually want to fund a new thing. Rather than, we know this works well for providing clean water everywhere. People don't want to fund stuff that's been going on. They want to do this new thing to get their name on it. And it's a challenge. It's a big problem. One thing I would say related to that, and related to pharmaceuticals, is there's someone named Thomas Pogge, P-O-G-G-E, and he's proposed a new way to deal with developing pharmaceuticals to address this 90-10 gap, is to have something called a health impact fund. And every country would pay in a little money, a % of their GDP, into this fund. And then people would develop new pharmaceuticals and patent them through this fund. And they would get paid based on how many people those pharmaceuticals helped, how many people they cured. So there'd start to be some incentive to dealing with diseases that affect poorer countries. So there's people thinking about these issues, about how can we collaborate or have this central fund to deal with some of this, but we need a lot more political will to get there.
Okay, I was listening and maybe I missed it, but I don't think you said anything about starvation or famine. Would you comment on that, please?
So South Sudan right now, Central African Republic are probably the two of the areas on the brink of famine as we speak. A lot of it, so one of the areas I work in is food security. So how do we get nutritious food to the people that need it when they need it so they have access? And a lot of it has to do, we have more than enough food for everybody, but how do we get it into those places? A lot of it's political. So we certainly see in places like that there's civil conflict going on and wars. So it's not just that it's too dangerous to get the food there, but sometimes when food shipments are coming, the different warring factions will steal it, or they'll tax the vehicles before they'll go through. It's just, yeah, it's very hard to get it where it needs to go. Climate change is another huge piece of that. So again, we work a lot in Malawi, and they have something there in many parts of Africa called the hungry season. So you've got your crop growing season, and then the time between when that last crop comes in and the new one comes in, they actually have a season where everyone just knows they're going to be hungry. There's a book called The Boy Who Harnessed the Wind, about someone who grew up in Malawi. It's a true story. He built a windmill to provide electricity for his hut. He was actually on Jon Stewart too. But it's a very good book to get some sense of what it's like to be growing up in an area where you don't have ready access to food. But there's no easy answers. It's a good question and no easy answers.
Over.
Yeah, I don't know if you can assess this, but many times we give money to support a child through a hunger group. And I know that some groups are more probably legitimate than others. I'm just wondering, does that really help, or is some of that lost when we think we're, supporting a child?
So I think absolutely that helps. I think that's a great idea. You can also, for many organizations, look up and see what % of donations goes to administrative costs. So you can see then how much is actually going to programs or to the child, and how much is being held by that organization to fund themselves. It's usually pretty easy to get that kind of stuff. I'm sure there are instances where the money might not be going where it's supposed to be going, but for the most part, I think that's a good thing to do, and I think it really does have an impact on people. I would say something that might have a bigger impact is, again, to think about who we're voting and electing into office. Why, right? So that we can make some bigger policy changes or structural changes so that everyone's going to have a little more, instead of us trying to one-on-one trying to do this. But if you're doing that, thank you, because it does make a difference in people's lives.
Over here.
You gave us many numbers on and statistics on things in the world nowadays. And two-part question: are these numbers on a World Health Organization site that we can see them? And also, does a World Health Organization have people that go into the nooks and crannies and the Bongo Congo to get all these numbers and tabulate them?
So those are good questions. So first of all, the World Health Organization does have a lot of data available, and it's actually easy to get. Like you can just type in WHO and go to their website, and it's easy to find and easy to figure out where it is. The World Health Organization also has a reputation for being very bureaucratic and slow moving to respond to issues. So like the recent Ebola, well, a couple years ago now, the Ebola outbreak, they took a lot of criticism for how long it took them to come up with some sort of coherent response. So I would say they're a little slow about getting into the nooks and crannies of different places. And the other interesting thing about the Ebola piece is, they always want to send doctors, and it was actually an anthropologist who figured out how Ebola was getting spread, because the anthropologist went in and found out about their burial practices. And so it was, bathing and dealing with the dead people who had been infected is what was causing the spread of the disease. But until that anthropologist realized, these are the burial practices, no one had any idea how it was bouncing from person to person. So the World Health Organization is criticized for being very bureaucratic, not being able to respond quickly enough to issues. They're working on it, but they do have good data. And the CIA World Factbook actually is another good place for data. They've got a lot there, and it's also an easy website to search.
And are they funded through the UN?
The World Health Organization is under the UN. They're part of the United Nations.
Question back here.
Yes, the lady earlier mentioned starvation. Break it down for me about Yemen.
Off the top of my head, I couldn't tell you the rate right now. I do know, again, they're in the midst of a civil war as well and having issues, but offhand, I couldn't tell you what percentage of the population is.
Is the blockade U.S. sanctioned?
I don't know.
From Saudi Arabia?
I am not up to date on.
I've seen the pictures and it just brings me to tears.
Yeah.
The U.S. would be involved in something like that.
And often when it comes to issues of starvation, that's what we remember, right? We see these horrible photographs, usually of kids from Africa suffering from wasting, where people are literally, there's all these stages of malnutrition. That's the worst one, where people are literally wasting away, wasting to death. And stunting is another measure that's used when you're looking at malnutrition. So are kids too short for their age, basically? And again, in many parts of the world, that's a big issue.
I just wanted to give a website for where to check on your charities, the Charitable Navigator.
Okay.
Google Charitable Navigator and it will give you lots of good information, and you will be horrified at some of the things that don't have good ratings.
I'm going to write that down. Thank you.
Charitable Navigator.
Charity.
Charitable
Navigator.
Okay. I'll check them both. Navigator. Thank you.
I looked that up all the time.
Yeah, a couple of questions. One is actually about Southern Sudan. A work that former President Carter actually have been doing with the terrible sickness over there is the Guinea worm.
Guinea worm. Yep.
And he did an incredible job that he reduced 90%. So one question about that. The other is some countries have put in place to if someone wants to be an elected official, they have to pass a psychological test. I think the country of Uruguay has done that, and the American Psychological Association has said that. Now, a lot of reporters who cover the Congress and the Senate and elected officials, they said that they know the people personally, and they said that they are, most of them, they have serious, they don't want to say names because they are reporters, but serious psychological problems. And when I heard, like for example, Paul Ryan, Speaker of the House, like many years ago, he said we have to find a way to send the senior citizen to an early grave. Obviously, the man is a sociopath. So, how do you put in place a psychological test for? And then if you can talk about the current.
Well, I think I would add that to the list of ideas about what can we learn that's happening in other countries that might be helpful here, right? I don't know. I'm not aware of, I don't know about that, so I can't really speak to it. But it's a very interesting idea.
President Carter did that.
But President Carter has done a lot, yeah, to eradicate guinea worm, a phenomenal amount.
Horrible sickness. He eat
So when you get worms or parasites, they're living inside of you. And so when you're eating your nutrients, it's those worms or parasites that are eating them, and they're not actually getting into your body, which is why people get so sick from them and weak. And then once you're sick and weak, you're more susceptible to getting other diseases. And there's a lot being done in sub-Saharan Africa to deworming programs. And ironically, so they take a pill. Like a lot of places, they'll have kids come to school twice a year, and it's only pennies to treat this. But I know it might have been the guinea worm cure. I know one of the cures they came up with, they used what we use here for dogs, deworming dogs, and found out, this might work on people. It might actually be helpful. But again, to think about how inequitable things are. We're so well off, we have pets, and we got medicine for our pets. And that could be helping people over there.
90%.
Yeah, President Carter's done, an amazing job with that, dropping that prevalence rate. He's done a lot.
What about overpopulation and birth control?
So overpopulation and birth control. So most researchers will claim that we can handle 10 billion people on the earth. Birth controls, that's another, in a perfect world, if things were equitably distributed, we could live harmoniously with the resources that we have. You're right, in a perfect world. Access to birth control is a huge issue, and there's something called the global gag rule. And this is something that, depending if we have a Democrat or a Republican in office, it's been flipping back and forth for the last, 30 years. So when we have a Democratic president in office, federal funds that are used for global aid can be used by organizations that provide family planning services. When we've had a Republican in office, one of the first things President Trump did, one of the first things President Obama did when he came to office was to rescind the global gag rule. One of the first things President Trump did when he came to office was to put it back in. So that means now that organizations are gagged. They can't use federal monies that the U.S. is distributing. There's a lot of technicalities, but a lot of them now will not use it for any family planning because they don't want the funds totally cut off. The fear is that some of those funds might be used to advise women about abortion. And so, when you talked about people working in silos before, there's also a lot of the start and stop of programs that happens too. Like if we've got a Democratic president, the global gag rule has been rescinded, we've got programs running providing family planning for women around the world. A Republican comes into office, the global gag rule's back in place, those programs stop. And so it's not just people working separately, but there's programs we know that work that are stopping and starting, depending on our politics here in the US too. But access to birth control and family planning could have a huge impact on managing the population. Women want it. No matter where they are in the world, women want access to family planning. But coming back to gender norms, a lot of women don't have power to advocate for that, to get their husband to use a condom, to get their husband to get tested for HIV/AIDS. It's that's another big issue to work on. And I would say that if I had to say one thing to give us our biggest bang for the buck to what we can do to improve global health, it would be to educate girls. So coming back, because once a girl is educated, we have research that shows if a woman is educated, not only is her family more likely to be healthy, her whole community is more likely to be healthy. And so if we can start educating girls, we'll grow up with that, but it also help to start addressing some of these patriarchal structures that so disempower women in so many parts of the world.
I actually have a quick question from someone online that's following along outside the room. It's regarding, they wanted you to speak on the topic of starvation again. And I'll just read exactly what they have. So people have been starving for years now. Time to regroup because it still exists. What positive things can be said about the work that has been done so far for this? And why not just solve the problem, is their follow-up question.
That's a great question.
It is,
right?
isn't it?
Why don't we just solve the... And I would say one thing that plays into that, and what I always tell my students, is look at the data. So getting to this issue, why don't we solve the problem? So often, if we were just look at the information or the research that's been done or the data that's out there, we can see what'll work best. But then the politics come in, right? Or someone's morals, which can vary from culture to culture. What's the moral or ethically right thing to do? But related to starvation, I wish I should have brought data with me. There is a lot of work that has been done. And the UN Millennium Development Goals, and to eradicate extreme poverty and hunger, and it's still one of the top 3 goals of the sustainable ones. It is one of the top priorities globally. And there's a lot of countries that use these goals, they use the targets. You can Google these too to get more information. And they have made a lot of strides. I struggle with that with the global health stuff because I always want people to be aware of how inequitable things are. But there's a lot of good stuff that's happened too. And hunger rates have decreased. There are fewer babies dying. There are fewer kids dying. We've eradicated smallpox. We've almost eradicated polio. There are successes.
Thank you from outside the room.
Okay.
Anyone?
Hello. How we make, or how we get the best result to universal care is spending less money. Now, yes, in the other way, we are spending too much and we get it nothing.
Correct. So as I mentioned, we're the only industrialized nation without a universal or national health care system. But we spend almost 18% of our GDP on health care. That's much more than any other country in the world. And again, if we would look at the data that's out there, we can see other countries that have a universal national health care system. They have better health, their people are living longer, their infant mortality rates are lower, they're spending a lot less money. Many places that have a universal national health care system also have a private system, because I know people will say, well, my friend lives in Canada and they had to wait 6 months for their knee replacement. It's true. Sometimes you might have to wait longer to get procedures done. But again, the private market has served some of those people who can afford it, who want something quicker. And the thing I would say here too about healthcare, like we want this market-driven, this private corporate approach, is we don't have a free market here when it comes to healthcare. We have an imperfect market. If you go and ask your doctor or nurse how much something costs, they don't know. So if you're trying to find the best deal, or if nobody knows what the costs are. It's really hard to find that out. And certain things get subsidized, certain things get negotiated through different insurance groups, and so we don't have perfect market conditions if we use this theory that the free market's gonna make all our costs come down. We don't have that as a starting point even.
For example, we don't import generic medicine right here.
Oh, generic, yes. So
right here, the medicine that are way too expensive.
So the issue with pharmaceuticals and access to generics, yeah, that's a lecture. And I actually have a whole lecture on that. Yes, that's a big problem. We could be doing things much more cost effectively.
I think so. The pharmaceutical has a lot of power.
The pharmaceutical industry has a lot of power.
They are not ready.
The insurance companies have a lot of power. So when you think about who's lobbying Congress to keep things the way they are, look at who's spending money to do it and whose best interests are at heart.
Our medical system is driven by the insurance companies. Mm-hmm. That's a fact of life. Mm-hmm. And when you look at the impact of what the insurance, when you buy insurance, really, as you look at the bills as to what actually gets paid versus what has been billed for, you are not buying for the ability for them to pay the bill. It's the negotiated discounts that they definitely get as a contribution to funnel their patients to the medical institutions. So the system is
the system's broken
in a process in which the person who is purchasing the care, me, the individual who is sick, is going to a provider who's going to provide the care, but the payment is coming from someplace else.
It's coming from a third party.
Third party.
Yep.
Keeps this totally out of sync.
Yep.
This leads me to, as you were talking through all of your various scenarios, our capitalistic model of government and the way we approach is based upon individuals and organizations getting a reward for their endeavors. And it takes away any imperative, because I have no social benefit to me to make this available. You know, one of the things we recognize in healthcare is that one of the reasons why America spends so much money in healthcare is because the dollar for that prescription here in the United States is so much higher than what is paid in any other country.
You were saying. Yep.
And so as a consequence of that, needless to say, it's going to cost more for healthcare here. Why is that? Is because the financial wherewithal is here. Think of it from the standpoint of that poor family in Milwaukee who cannot afford health insurance, can't get those negotiated discounts, gets that $13,000 bill for an emergency room visit.
Yep.
Compared to the rest of us who, through our employment or whatever else, have had health insurance and those negotiated benefits. That's where the inequality begins to really raise its head.
Yep. Absolutely. And so, do we want a capitalistic system to service our health?
There are certain aspects of life that capitalistic system works for. Healthcare is not one of them.
I would agree with you. I would agree with you. And as I mentioned, healthcare costs are the #1 cause of bankruptcy here in the U.S. It is. It's a big problem.
Any other questions? All right, then, that is it for this evening.
Thank you.
Normally, this would be our last Great Decisions evening, but don't forget, next week we have Beth Doherty here talking about Turkey with the Great Decisions that had to be postponed because of the weather. Have a great night.